There was a time when healthcare was 100% supported through government reimbursement, whether it be by insurance or by our 330 grant. That no longer exists. Right now, it's supported 70% approximately, and 30% of the costs of providing care to these underserved communities. We have to become much more creative in getting those numbers. For us, the challenge is, how do we get our community well? How do we keep them well? How do we fund that wellness? And how do we have the government see us as a leader in healthcare and not a supporter of acute care in hospitals?
Where we sit today is a very fragile environment. We as community healthcare centers are strapped right now. We are seeing an epidemic across the nation of having to do reductions in force, having to make decisions to shut down service lines because all the funding has changed and lessened. And so we're trying to do as much as we can with what we have. We're pleading, we're begging, please let the monies that are going towards the base be towards our base grant to increase the opportunity for us to continue to serve the patients for which already come to our healthcare centers.
I mean, ultimately, the problem becomes one of access, because the fewer primary care clinicians we have, the fewer people we can treat. And that starts a whole cascade of problems. With less revenue, we are shutting down programs and we're shutting down sites. And it gets back to even less access. And you have this domino effect that continues. So we have to try to stop that problem by recruiting.
It really is hard to recruit the kind of high quality clinicians that we want. And the price of that continues to escalate. That's a very real thing.
The grant environment also is not very healthy right now at the state and the federal level. And so we would usually look to be able to lean in that space to be able to cover those gaps. And the reality is that we just can't anymore. So we are appreciative when a grant comes through. However, we are not seeing them as we used to pre-COVID times.
We are necessary. And if you didn't have FQHCs and you didn't have Medicaid, even if you're not a Medicaid beneficiary, if you don't use federally qualified health centers, it is something that impacts everybody. And if there isn't an avenue for our patients to receive affordable quality health care, then it's going to drive the cost of that care up. And it's going to be assumed by the public.
We've proven that if we take care of somebody, we save society money. And that's an important part of our goal.
And so everybody should have an incentive to want to understand that and to want to support the programs that we provide and to want to support Medicaid. I think it's easy not to support something when it doesn't impact you directly.
Community health care is where lives are saved.